Morning. Joe Sanchez back on the air with us, along with Susan Herrick, the Communicable Disease Public Health Nurse for Mason County Public Health. Good morning, y'all. How you doing?
Good morning.
Thanks for coming in. This is fun to talk with you and get to meet you, Susan. Been with the county for, what you said, 2 years?
Mm-hmm. That's right.
And Joe, how are you coming along here?
I'm doing great. It's baseball started, so I'm all excited about that.
Big baseball fan?
Oh, yeah, and I'm excited about National Public Health.
Yeah. That's why we're really here today to talk about National Public Health Week. So, Joe, what is National Public Health Week, and what does it mean for us here in Mason County?
Okay, so this comes from the White House. They basically issue a proclamation. The president signed it, so I have it right here. We can always put it up on the website for you. And it's basically just kind of reminding everybody, calling upon states and organizations and nonprofit and individuals and everybody to just, it's a time to be mindful about your health, maybe go get your checkups, teach people about it, teach your kids about it. And so that's basically what it's all about. So here in Mason County, it's kind of a time for us to reflect on, where we're headed. And I do want to mention that our ranking is up again. They just came out 2 weeks ago.
Oh, great.
And we're up to 29th now. And we were 37th in 2010. And each year we're
getting better,
progressing. So that's a big...
You were here at the beginning of last month. Was that right? So just within a month, some more numbers have come out.
So it comes out every year. It's a big study that's done, and it comes out every year. And it just... When we interviewed, it was kind of towards the end of the year.
Oh, okay.
Or of that study. And now here's the new study that just came out. And so it's available on countyhealthrankings.org, and you can take a look at that and play around with it. It's pretty fun to see some of the numbers.
Interesting.
So I do want to mention that a few things that did drop that are actually pretty exciting is less people are choosing to smoke. So that's a really big deal because that directly contributes to, disease prevention and your lifespan. And premature, teen births has also dropped, and unemployment ranking is the lowest it's been since 2010. So
wow,
some good things.
That is very good.
So do you think this has to do with public outreach that you guys have been doing this last year that helps with that, or?
It's a community. It's all community. It's not necessarily anything we're doing. There's a lot of collective impact work going on. Mason Matters, for example, they bring a bunch of stakeholders together. So what the push now is that instead of just letting all these individual organizations handle things, they're coming together in coalitions and bringing all the stakeholders together and saying, how can we start working so that we're all flowing together and using each other's resources? And so that collective impact approach is what you'll start hearing a lot about here in Mason County.
Susan, you're the Communicable Disease Public Health Nurse for the county.
That's right.
And one of the things that we're going to talk about here with you, I believe here, is National Drug TakeBack Program. Are you with that, or is that Joe?
That's
still with you?
Actually.
Okay.
I'm going to talk about immunizations.
Yes, perfect.
Actually, Ben Johnson, who sits next to me, he's an amazing resource. He's been with the county for a long time, and he's done a lot of work. And over the past several years, he's been working with this prescription drug take-back program. So he goes out and promotes it. The sheriff's department actually holds it. So do not bring your prescription drugs to us, but we can tell you where to take them. And we'll have the two sites available on our website. There's a little drop box that you just go put your prescription drugs in. But there's some cool statistics. Just in December and January, they've had 247 pounds collected of prescription drugs. And so this goes, the DEA, and these are really interesting numbers. So nationwide in 2010, they started this program. 242,000 pounds of prescription drugs were collected. And 2014, the latest numbers we have, 780,000 pounds of prescription drugs that were, taken back by the public. So it's not ending up in the water. It's not getting stolen. It's not ending up in the wrong hands. But the cool thing about it is people are just doing this all on their own. They're actually getting their cars, going all the way down to the drop boxes. And I just think that's amazing. It shows you the power of people. I'm kicking myself that I didn't invent this program. So go ahead and we do that year round, but now's the time for us so Ben's got his sign up on the public health, building.
Is there a picture of what that amount of pounds looks like? Because when I think of prescriptions, they're tiny little pills, and it all adds up to hundreds of thousands of pounds.
I did look for one because I wanted to show it, and I couldn't really find anything, so I'm sending an email out and if I do find something, I'll post it on the Facebook page, because stuff like that is really cool to see. And
Yeah.
I'm kind of bummed that I didn't get it.
Yeah.
But
It is amazing to
Yeah.
think about how many pills probably goes into
lot.
250,000 pounds.
And people can just drop off all year. This is just your push for the
Yes,
awareness.
it's a. Mhm.
That's really good,
Yeah, it's a
because
neat
you're thinking,
program.
what am I supposed to do with all this stuff? So
Yep.
we have that option now.
It's pretty neat.
All right, immunizations, and we're going to turn it now to Susan on this one. Talk to me a little bit about immunizations. Should we get immunizations? Where are we at with the county and things like that?
Okay. Well, yes, you do need to be immunized. There are so many vaccine preventable diseases. Whooping cough is one of those, and whooping cough is on the rise. So that's why I kind of decided to focus on whooping cough. It's known as pertussis. It's highly contagious. It's a bacterial infection, and it's one of the most common vaccine preventable diseases in the United States. Last year, in the state of Washington, we had 1,381 cases. So that's quite a few.
Okay.
And this year so far, there's 92. So it's a bit down, but we still have a lot of work to do.
What's the vaccine for this?
It's called Tdap. It's for tetanus, diphtheria, and acellular pertussis, which is whooping cough.
Oh.
And so it's a combination vaccine, and they make a childhood version of it called DTaP, and that's what babies have. 2, 4, and 6 months, 15 to 18 months, and at 4 to 6 years. Those are the dosings. That's the dosing schedule. So it's very important for children to get those vaccines. So they have 5 DTaP before they even start kindergarten. Then as they get older, immunity wanes. So at about 11 to 12 years old, they're supposed to get the Tdap, which is the adult adolescent version. And so at 11 to 12 years, that's when they get that one.
I remember when I was in school, we would get the nurses came and we got the vaccines at school. Is that program still happening?
No, actually, no. We don't go into the schools, or the state doesn't go into the schools. What we do is your primary care provider has the vaccine, or pharmacies have the vaccine now. And actually, we do too. The public health department has the Tdap vaccine available for uninsured, underinsured, Medicaid eligible. And so it's really easy to access the vaccine.
So you say around 11 or 12, the last inoculations are starting to wane a little bit. Are there additionally, through the years of through adulthood, that you need to maintain on this?
Yes, you just need to get one Tdap, but after that, every 10 years you get a TD, which is the tetanus diphtheria only. So that's the only pertussis one, or whooping cough one. And that's especially important because babies are very vulnerable. And so each pregnancy, a woman needs to get a Tdap. Each and every pregnancy. Okay?
So the P in those is pertussis.
Right. Right. That's the whooping cough. And let me give you a few statistics about how serious the disease is for babies. More than half of the infants less than 1 year old who get the disease must be hospitalized. About 1 in 5 infants with whooping cough get pneumonia. About 1 in 100 infants will have seizures with the disease, and about 1 in 100 infants who are hospitalized will die from the disease.
Wow.
So it's very serious to babies, and it causes a cough which can be kind of violent and have spells, so that there could be apnea where the breathing actually stops for a time, or it's so hard to catch their breath that they make a whooping sound, and that's where the name of the disease comes from, whooping cough. They kind of have a strong whooping noise when they cough. So it's very dangerous for babies, and that's why it's so important that mothers are vaccinated and people that are around babies. Like Joe's going to have a baby soon. His first
Congratulations.
one. Yeah, it's really
Brought
exciting.
this up, and I was like, oh my gosh,
Gotta
I
get this
haven't
done.
this.
Yeah, so he's going to need to get a Tdap, and anyone around that's going to be around the baby, grandparents, siblings, aunts and uncles who will be with the baby, need to have that vaccine. So, because that's where the babies are getting it, through the people around them. So that's how we can protect babies. And so Joe will need to be doing that.
Sign him up. Make sure he gets scheduled.
I will.
So you can go to a primary care physician or clinics like that. They have got these.
Yes, pharmacies do.
And underinsured folks can go just to the county?
Yes. And it's provided free at the county. So we're happy to have people come in, and we're glad to do that for them.
So if you don't remember when your last booster shot was, you should just go get the vaccine.
Absolutely. If you don't remember, especially if you're going to have a baby in the family, to protect that baby, don't worry about it. Just come in and we'll give you one. Okay. It's not a problem.
It's 8:25. We're talking with Joe Sanchez and Susan Herrick, the communicable disease public health nurse, meeting her for the first time on Daybreak. And Public Health Week is going on in Building 1 in downtown Shelton. You got a display going on. Also, some prizes. Joe, what's going on with this?
Yeah, we have a display case, and it's some things that maybe you forgot about, or just kind of a reminder of some things. So take your kids down there, your family. You go walk right when you walk in the building. It's right there, and we have a little drop box there. You can write. We have a little question. You can write your name and the answer to the question. Drop it in there. There's a big fun run coming up. We have free entry to that, plus 4 like 50% off discounts, and then there's a local restaurant that donated a gift card. So they're good prizes. So
wow. Yeah. All right. So it is in the County Commissioner's Building in downtown Shelton, Building 1. You can just walk right in there and see that. Mason County Public Health on the internet. You can just Google that. Also on Facebook. I know you guys have a pretty good Facebook presence as well, and we link to a lot of these from our page as well.
Yes.
So we definitely thank you for coming in. Joe Sanchez, the community health educator, been on a couple times with us now, and Susan Herrick, the communicable disease public health nurse for Mason County Public Health. Thank you so much for coming in today.
Thank you for
some great information.
Yeah, thank you, Susan. She was a little nervous, and this is her first time, and she's amazing, and Mason County should be so proud to have her. She is a hard worker. She's an unbelievable asset for us. So
well, it's good to know. Good to meet you.
Thank you. It's nice to meet you.
8:28 now at iFiber 1. We'll take a quick break. When we come back, we'll get the morning stock numbers, and Mary Lynn Foster has the news here on Daybreak.